Welcome to the online video resources for head and neck by numbers. My name is Felicia Sigurd, and I am a dental hygienist and the author of Head and Neck by Numbers. I will also be your guide through the names, locations, and relationships outlined in the text. So let's start with how we use the text. It is very important that you do not write the names on the pictures. The whole point is that you're going to write the number that associates with the other page. So then you can flip it around with that coil binding and just look at the image and quiz yourself. So we'll go through, if you're looking at figure 1, the way it would work is I would say number 1 is superior, and on the screen will flash the image of what you need to color. Now, these videos were made to be short, so I'm not going to just stand here while you color, so feel free to pause me, color, and then start again. Now, we have to get something straight. I am not giving you the grade for this class. So if you find that there's a discrepancy between my book and what your teacher tells you, go with your teacher, okay? But other than that, I think that your teacher and I are both helping you to be a better student and learn anatomy in fun and interesting and hopefully helpful ways. Number 19 is the mandibular branch of the trigeminal nerve. Number 1 is the trigeminal ganglion. Number 2 is the ophthalmic branch of the trigeminal nerve. Number 3 is the maxillary branch of the trigeminal nerve. Number 4 is the foramen ovale. Number 5 is the mandibular branch of the trigeminal nerve, and it exits the skull through number 4, the foramen ovale. Number 6 is foramen spinosum. Number 7 is the meningeal nerve. It uses foramen spinosum to enter the skull and innervate the dura of the brain. Number 8 is the otic ganglion, and it has 3 branches. The first branch is number 9, the medial pterygoid nerve, and it innervates the medial pterygoid muscle, that muscle of mastication. Number 10 is the tensor tympani nerve, and it innervates the tensor tympani muscle, a muscle of your inner ear. Number 11 is the tensor veli palatini nerve, and it innervates the tensor veli palatini muscle, which is part of the soft palate. If you need help remembering the branches of the otic ganglion, think that the otic ganglion makes Timpi tense. I don't know if you've ever met anyone named Timpi, but I know someone named Timpi, and the otic ganglion makes Timpi tense. Makes for medial pterygoid, Timpi for the tensor tympani nerve, and tense for the tensor veli palatini nerve. Number 12 is the anterior division of the mandibular branch. The anterior division reminds me of Ant M. Ant for anterior, and M because most of the branches go to the muscles of mastication. So remember, anterior division, Ant M. Number 13 is the deep temporal nerve, and it innervates the temporalis muscle, a muscle of mastication. Number 14 is the lateral pterygoid nerve, and it innervates the lateral pterygoid muscle, a muscle of mastication. Number 15 is the masseteric nerve, and it innervates the masseter, also a muscle of mastication. Number 16 is the long buccal nerve, and it innervates the buccal mucosa of the cheek and the buccal gingiva of the mandibular molars. Number 17 is the posterior division of the mandibular branch. Number 18 is the auriculotemporal nerve. When you hear that word, think of auricle for your ear and temporal as in the area of the temporal bone. That will help you remember the innervations, which are the skin of the ear and the skin of the temple. Number 19 is the inferior alveolar nerve. It innervates all of the teeth on the mandible, so it is also a nerve that we commonly anesthetize for dental treatment. Number 20 is the lingual nerve. It innervates the anterior 2/3 of the tongue, the floor of the mouth, and the lingual gingiva of all mandibular teeth. We've now learned the 3 main branches off of the posterior division. If you want an easy way to remember, think of the word pale, P-A-I-L. P for posterior, A for auriculotemporal, I for inferior alveolar, and L for lingual. Number 21 is the chorda tympani nerve. It is actually a branch off of cranial nerve 7, the facial nerve, and it merges with the lingual nerve. It has three innervations: the submandibular salivary gland, the sublingual salivary gland, and taste. Number 22 is the mylohyoid nerve, and it innervates the mylohyoid muscle and the anterior belly of the digastric muscle.
Number 23 is the mandibular foramen.
Number 24 is the incisive nerve, and it innervates the mandibular anterior and premolar teeth. It is a branch of the inferior alveolar nerve, so if you anesthetize the inferior alveolar nerve, all of those included teeth are anesthetized also. Number 25 is the mental foramen. Number 26 is the mental nerve. It innervates the labial gingiva of the mandibular incisors, the skin of the chin, and the skin of the lower lip.